Hello everyone, my name is Florence Nightingale. A little introduction about myself is that I was born on May 12th of 1820 in Florence, Italy. It is no coincidence that my name is Florence and that I was also born in Florence, Italy. I was born to a wealthy family of England. It was from a young age that I began to practice philanthropy within my church and with the surrounding impoverished areas of my community. At that time in history, nursing was not considered a prestigious profession. Many upper classes, including my family, had looked down upon the profession. Although my family discouraged me from continuing nursing, I decided to go along and continue my studies at an institution in Germany for nursing. Soon after I graduated from nursing, the Crimean War had broke out. By this time, I had had a few years of nursing experience underneath my belt and was working within the local hospitals of England. However, when the Crimean War broke out in 1854, I was asked by the England government to organize a group of nurses who would be willing to travel and provide care to the wounded soldiers. Of course, I did this immediately, and within the next few days I was off on my way to help the soldiers from the Crimean War. When I arrived, I noticed that the current conditions of the hospitals and facilities there were horrible. At these facilities, there was contaminated water, rodents scurrying around amongst the patients, scarce supplies, and very overcrowded areas. It was during this time that I was known as Lady with the Lamp, or Angel of the Crimea, due to my dedication and hard work to provide adequate care for these soldiers. While I was overseas, I was able to improve hospital conditions and reduce the death rates by 2/3 after my arrival. When I returned home to England, I was recognized for my hard work and dedication. I was the original recipient of the Nightingale Jewel, issued by Queen Victoria. Along with this jewel, I received a $250,000 cash prize from the British government. With this money, I was able to fund the opening of the Nightingale Training School for Nurses at St. Thomas Hospital. I believe that nurses at this time were lacking the proper education and there needed to be a change. With my opening of the Nightingale Training School for Nurses, my hope was to improve education and training skills for nurses in order to provide more adequate care for the patients in need. In addition, a fun fact is that International Nurses Day had begun on my birthday. Later in life, I fell ill to the Crimean fever that I had contracted while overseas. With contraction of this terrible disease, I remained bedbound for the rest of my life. However, that did not stop me with my education reform, as well as my reform for environment. I later developed the environmental theory, which I will discuss later on. In addition, in 1859, I wrote the Notes on Hospitals, which included instructions on how to properly run civilian hospitals. I had passed away on August 13th of 1910 at 90 years old. Back to my environmental theory, there were multiple components that I believed would promote health and optimize healing. Some of these components consisted of pure air, pure water, efficient drainage, cleanliness, and adequate light. Pure air. During the Crimean War, I noticed that there was a high infection rate, and this could be very well related to the poor ventilation and overcrowding conditions that existed within the hospitals. Another component of my environmental theory was pure water. The need for clean, pure water is high in order to promote healing and optimize health. During the Crimean War, there were many waterborne diseases such as cholera, which would infect the soldiers and the population. Even in present time, there is still a need to ensure that all people have pure water access. There are current initiatives in place to provide everyone with safe drinking water, especially those who may be in third world countries or impoverished areas. Nextly, efficient drainage. Efficient drainage goes hand in hand with pure water. If there's not efficient drainage, such as sewer systems, there's an increased bacteria in our water source. Next to be discussed is cleanliness. Cleanliness is very important. It is important because hand hygiene and sanitation of the environment promotes good health between patients, as well as decreasing the risk for transferring infection from patient to patient contact. Finally, one of the last components of my environmental theory is light. Poor lighting can contribute to various accidents within hospitals and within the environment surrounding our hospitals, such as in our communities. In present time, you would see that without the traffic lights, there could be an increased risk for vehicle accidents, leading to more patients becoming hospitalized due to tragic accidents. In addition, bacteria is known to grow in dark, moist places. So without adequate light, we are harvesting more and more bacteria to be growing. I also have a strong desire to promote education within the nursing profession. I was able to turn nursing into a profession from a service. I was also able to open the training school for nurses due to the generosity of the British government and Queen Victoria. With that money, I was able to encourage education and training for nurses in order to transform the skill and art into a profession. Some key terms related to a theory is the human responsibility individuals have to optimize their own health and to take initiative in providing themselves with a clean environment. Next, environment. It is key to realize that the environment has big effects on the health and can contribute to either a good or bad health. Next, to just touch upon health, we are trying to promote individuals' health, to promote autonomy, and to help individuals see that they are able to take initiative into their own health care and their own health practices. Next is nursing. Nurses need to know how to provide adequate care to promote health and to decrease risk for infection and various diseases. My environmental theory is to be considered a grand theory. It is broad in nature, however, it provides the basic framework for future research to be completed on. An example of research that has been conducted based off of my environmental theory is a study that was conducted in Brazil. This study looked at the home environment of children exposed to HIV at birth. The purpose of the study was to get to know the environment and identify risks that could contribute to future health problems within these children. The approach of this study was considered qualitative and interviewed 10 HIV-positive mothers who were caring for at least one exposed HIV child at birth. The findings of the study were able to conclude that unsanitary home conditions increase the risk of children developing the further illnesses. This was further able to elaborate on what qualities consisted of and what exactly the unsanitary conditions were that contributed to these further illnesses. By doing this research, the researcher was using my environmental theory to look at how is the environment impacting my patients? How is the environment going to change the outcome of these patients? Even in today's time, my theory is applicable to current day practice. In this case study, there presented a 56-year-old female who was initially diagnosed with COPD exacerbation and pneumonia. Her initial complaints were shortness of breath and feeling the inability to breathe. She felt like she was having air hunger and unable to breathe in the adequate oxygen that she felt she needed. She was initially on 2 liters of oxygen, however, had been increased to 6 liters prior to arrival from the paramedics. When the patient arrived to the hospital, we were able to conduct an initial assessment. In the initial assessment, we noted that the paramedics had stated there were unhealthy living conditions at her home. With this knowledge, we knew it was necessary to advocate for the patient and to get the patient in to see social work. With giving the referral to social work, we were able to determine that social work would be able to work with the patient in order to provide adequate housing and to begin the discharge planning for the patient. The patient needs adequate housing with environmental cleanliness, water, proper ventilation, proper elimination, and overall cleanliness in general in order to promote optimal health in the healing process. Due to this patient having previous comorbidities such as COPD, we know that it is very important to promote this patient's health through her environment in order to optimize her health. These are the references used for this presentation. Thank you for watching.